My name is Mpaso Lipava, and today we are going to discuss more about anemia. So, I have blessed with a guest who will give us more information about anemia. So, I welcome you, and I beseech you to introduce yourself.
Thanks. My name is Jairus Chopiga.
So, let's talk about anemia. I want to know the definition of anemia.
If you can say about the anemia is a blood disorder which happen normally when someone don't have enough red blood cell in a body.
Yeah.
That's the definition of anemia.
Okay, we can say anemia, a common disease.
Yes, anemia is a common disease. If you can go to any country, you can get people who suffer from what? Anemia. According to the question that is anemia common disease, the answer is yes. So the expert estimate that most people in Malawi have anemia. They also estimate the condition affect 1 or in a 3 people in a global population.
Yeah.
It means let's say for a estimation maybe in a range of 10 people, maybe we can get a 5 maybe the people who suffer from anemia.
Okay, so what are the symptoms of anemia?
There are most symptoms of anemia. There are so many signs which you can know that patient is suffering from anemia. The first symptoms is headache.
Okay.
Yes. This is the second one is a shortness of breath. Which is also called dyspnea.
Yeah.
The second one is heart palpitation. And the fourth one is dizziness. The fifth one is fatigue. Maybe you can aware of words of fatigue. Is a feeling too tired to manage your activity. Just to feel the tired. Just notice that a person is suffering from what? Anemia. Symptoms is a frequent infection. Yes. The patient undergo different disease because the lack of what? Blood.
Yeah.
But either way, in another way, I can say that his blood is so weak, so that's why it is affected by other disease.
Okay.
Yes.
So, what causes anemia?
Causes of anemia, I can say, many things can happen to cause what? Anemia.
Yeah.
For example, iron deficiency anemia is also the what? The common type of anemia. But you can develop the what? Type if you don't get enough iron from the what? Food you eat.
Yeah.
In a short way, the causes of anemia, I can say, is a lack of iron in a what? In a body. If a person fail to eat, if a person don't eat the food which contain iron, they obviously undergo sick anemia.
Okay.
Yes.
So, how anemia is acquired?
Anemia is acquired in so many ways, but this time let me explain. You develop or acquire anemia from something that happened during maybe your lifetime, like a condition that caused it. Acquire anemia include the first way is anemia of chronic disease. Anemia of chronic disease, it develop this condition if you have an illness that causes chronic inflammation.
Yeah.
Yes. Or other way, it making it hard for you body to use the what? Iron. It need to make red blood cell. This is anemia of chronic disease. It makes the body to absorb the what? The iron, which help to make the what? Red blood cell. This iron, if it is short in your body, the patient is obviously to what to acquire the what
Anemia.
The second one is autoimmune hemolytic anemia.
Yeah.
In this I can explain that your immune system attack your what red blood cell. And this it only the what attack the red blood cell. This is how the anemia is acquired.
Yeah.
And the third method, the third way is microtic anemia and the megaloblastic anemia. This type, no, this way of acquiring this type of anemia that are developed when bone marrow makes unusually large red blood cell. Do you know about the bone marrow?
I don't know.
Bone marrow is where the joint, where the bone meet. Let's say at the leg. Yes. Inside this is where this happen. There's some book just to say certain what medical condition artificials may cause this type of anemia. Health center provide a condition vitamin. Just the health care provider may call this condition vitamin deficiency anemia, so that they can help.
Okay.
Another anemia which are acquired is what pneumatic anemia. Yeah, in this pneumatic anemia, you can have a few red blood cells than usual. They may cause what pneumatic anemia. The fourth one is what pernicious anemia. This pernicious anemia, it lies the condition which one of the causes of what vitamin B12. Do you know about the vitamin B12?
No.
At a second, I think I was learning about that B12, but as of now I forget it. But let's proceed.
Okay.
You can also develop anemia if you have certain chronic disease. Yes, anemia may be symptoms or complication of following. Yes. Autoimmune disease, one. The second one, cancer. The third one, inflammatory bowel disease. The fourth one, kidney disease. The fifth one, liver disease. Another one, thyroid disease. Sixth one, inherited anemia. So, an inherited anemia is when you're born with a condition. Inherited anemia can include diamond blackfan anemia, which inherited disorder keeps you bone marrow from what? From making enough red blood cells. Falcon anemia, which is rare blood disorders. People with a falcon anemia are increased risk of blood disorder, including what? Anemia. There are also this sickle cell anemia. This condition changes your red blood cell shapes, turning round, flexible disc into the stiff and sticky sickle cell that block the what? Blood flows. It makes the blood in a body felt what? To flow easy. That's why the person will go undergo what? Anemia. This is how I can answer how the anemia can acquired.
Okay, so what are the types of anemia? Maybe inherited, but can also be acquired.
Okay, the type of anemia which people can inherit but also acquired. In that question, I can answer that the first type is plastic anemia. This anemia happens when stem cells in your body marrow don't make enough blood cell. This type of anemia, plastic anemia, it happens when the what? Stem cell or bone marrow fail to make what? Blood cells. This is how the plastic anemia do. The second one is hemolytic anemia. In this anemia, your red blood cell break down or die faster than the usual. This type, it makes the what red blood cell to die faster, as that the person undergo what anemia.
Yeah.
The third one is the microtic anemia. This microtic anemia, the anemia happen when your red blood cells don't have enough hemoglobin. Hemoglobin is what makes the blood to look red.
Yes.
So they are smaller than usual. Microtic anemia occurs with iron deficiency. Another way is sideroblastic anemia. It also occurs in some people who have what anemia of chronic disease. Yes, this is the way I can explain about the type of anemia. I have already explained about the hemotic anemia, microtic anemia, sideroblastic anemia.
Okay, so how is anemia diagnosed?
The way how the anemia can be diagnosed, according to your health care provide, we also ask a question about the symptoms. Anemia happen when you don't have enough healthy red blood cells. So they have what blood test which can use the doctor to diagnose. The first one is complete blood clot.
Yes.
Complete blood clot. In an abbreviation, I can say CBC.
Yes.
I can justify that point with that healthcare provide use this test to check on all of your blood cells.
Yeah.
If you focus on your red blood cell, I can add with medical pathologists examine the blood samples to quote your red blood cells. They also examine your red blood cell size and shape. Healthcare provide use the test to check on your vitamin B12 and or B9 levels. They also this test hemoglobin. We are discussing now how the anemia can be diagnosed. First, I already explained about the complete blood count. The second one is the hemoglobin test.
Yeah.
Hemoglobin test is the main component of red blood cell. This is the hemoglobin. This is the test which makes the to see how the blood looks.
Yes.
How the colors of blood. That it is blue or red. But the normal blood must be red.
Yes.
The test is often used to detect anemia. The third one is a hematostrix test.
Yeah.
Hematostrix test. This test measures the percentage of red blood cells in a body. This test it will only determine the percentage of blood in a body.
Yeah.
Or other way, it measures the percentage of red blood cell in a body.
Yes.
The fourth one is a peripheral blood smell. Peripheral blood smell. This healthcare provide examining your red blood cell under the under microscope to access blood cell size and shape. This test it only examine the blood cell under the microscope to know the size and shape.
Yeah.
The size of the red blood cell, how it is looked. Yes. How it is shaped. Yes. This is how I can explain about how the anemia is diagnosed.
Okay, so what are the complications of anemia?
Complication of anemia, I can say in a hospital, the chronic anemia can cause serious medical issue.
Yeah.
Like heart attack, heart failure, and organs damage. Chronic anemia is anemia. Maybe you can ask, what is chronic anemia?
Yes.
I just want to give you a definition. Is anemia that healthcare provide, don't diagnose and treat, or that continue despite the treatment.
Okay.
Yes. I think I will answer about that question.
Yeah, I have
Yeah.
well understood.
You can complete with your question.
Okay, so how is anemia treated?
The way we can use to treat the anemia, the first way is the iron supplement. We need to, at the first I have explained that anemia, it caused by lack of iron in your body.
Yeah.
So the way of treating, we need to take that iron in your body. That's why I call that iron supplement.
Yeah.
This supplement comes in a capsule or tablet that you can take by mouth with a glass of water. The second one is the folic acid supplement.
Yeah.
So you need to add the folic acid in a body.
Yeah.
Including the vitamin B9, like folate. It's also essential vitamin that help body to form red blood cells.
Yes.
And the DNAs. This help to building blocks of your body to make the body to be the strong.
Yeah.
Yes. Last one of how we can treat the anemia is a vitamin B12 supplement. The person who suffer from anemia must add the B12 supplement vitamin. A vitamin B12 supplement supports the production of healthy red blood cell.
Yeah.
Yes. If you undergo the anemia, you need to eat food which contain vitamin 12.
Yes.
This thing, it supports the production of healthy red blood cells.
Okay, fine.
Yes.
So can I fix anemia by myself?
You can fix anemia by yourself. Let me explain. Most time anemia causes mild symptoms, and a short-term issue that may be able to manage by changing your diet or taking supplement once a health care provider constitute that anemia is a reason why you have certain symptoms. So if you can ask that can you fix anemia by yourself?
Yes.
I can say that anemia causes symptoms of other disease. For example, something other than anemia may be why you feel exhausted no matter how much you rest, how much you get. Yeah. So talk to your health care providers if you have fatigue or other change in your body that don't go away within the 2 weeks. They will also find out what is causing you symptoms and treat the condition. This is how I can answer that question.
Okay, so can anemia be prevented?
Yes, anemia can be prevented.
How?
You may be able to prevent the most common type of anemia. So this anemia can be easy to prevent. Iron deficiency anemia by including iron-rich food in your everyday meal and snack. So the person who suffer from anemia must eat the food which contain the iron.
Yes.
Everyday meal. Yeah, and and other snack. So, but the other type of anemia you can't prevent, including in heart disorder.
Yes.
There are other anemia which you cannot prevent it with eating iron food.
Yeah.
That's anemia is inherited disease. This is come from the blood from the parents. By the way, inherited from your parents. Yes. Okay. Yes. You can proceed. I think I asked.
So, okay. Can I live a normal life with anemia?
According to that question, it just depends. It just depends your situation, how you feel. The treatment may manage anemia symptom, but many things can cause it, like the incurable inherited disorder and chronic disease, chronic anemia, like anemia that goes without treatment. Can cause serious complication including organs damage. If you have anemia, ask your health center provider that you can expect to help you.
Okay, so how do I take care of myself?
The way you can use to take yourself,
Mm.
you can first you need to know the type of what anemia that are short term and mild. Other can last lifetime. Regardless, there are several things you can do to help manage symptoms.
Yeah.
That are what some suggestion. Firstly, take your supplement directly. Thirdly, drink a lot of water. Yes. So you can stay hydrated. Third one, keep moving. Regular exercise is part of a healthy lifestyle.
Yeah.
But be sure to check with your healthcare providers about the way you expect safety, about the way you exercise safety.
Okay.
The last one is the protect against infection. Wash your hand often. Ask your provider about vaccination. Yeah. That help prevent viral and bacterial infection. This thing will help you to take care of yourself.
Okay, when should I see medical care?
Where you can seek the medical care. I want to say that if a person who suffer anemia, if you have anemia, you should check with your providers. If your symptoms get worse, yes, despite the treatment, or if you notice change in your body, that may be new symptoms. Yeah. The way I can answer that question is go to the health provider. Is where you can seek the medical care. Okay. Yes.
So when should I go to the emergency room?
The time you can go to emergency room, I can say the anemia may be increase your risk on heart attack. Cause 911 if you have following symptoms. Yeah. There is number which the health provider give people when they see the sign. They call them. Okay. So the reason you can go the chest pains. If you feel the chest pains, you can call this number. If you feel the shortness of breath or trouble breathing, if you feel the fatigue, if you feel the trouble sleeping, yes, fail to sleeping, if you feel the stomach discomfort, if you feel the heart palpitation, if you feel the anxiety or feeling impending doom, if you feel the sweating, yes, if you feel the feeling lighting or dizzy or passing out, those things, if you can feel this thing, you can go to emergency room.
Okay.
Yes.
So what is your advice for people who are affected or not?
My advice which I can give to those people who are affected or not affected, I can say that anemia happen when you don't have enough red blood cell. Yeah. Or your red blood cell are not working as well as they could. I want to remind you when we start this program. Yeah. You say that anemia is lack of what? Iron in a body. Yeah. So if you find that your body is lacking iron, you need to what? You need to say the food to eat the food which contains the what? Nutrients, normal iron. If you feel that your body have already iron, yeah, so you can continue to eat the light food. Yeah. If you can eat light food, it means you love your life. It means your body cannot suffer from what? Anemia. But some people are born with a form of anemia. But most people who have anemia develop condition over time. Yeah. That's why it's important to keep track of change in your body. For example, all have days when we feel warm out. But if you are feeling very tired for several days, yes, despite getting rest, consider the taking to healthcare provider
so that they can treat you.
Yeah, the healthcare provider, they can treat you. They can know you the condition you are. Yeah. Either you are anemic or you are not anemic. If you are anemic, they can treat you with advice. If you are not anemic, they can treat you also with what? With advice to continue to be the what? Positively. Okay. Yeah, this is where I can explain.
Let me summarize what Jairus Tropika said. So he said that anemia is a common blood disorder that occurs when there is a decreased number of healthy red blood cells or hemoglobin in the body. So hemoglobin is a protein in red blood cells that carries oxygen to tissues throughout the body. When the body lacks enough red blood cells or hemoglobin, it cannot get an adequate supply of oxygen, leading to various symptoms and health complications. So there are several types of anemia, each with its own causes and characteristics. So the most common type is iron deficiency anemia, which occurs when the body lacks sufficient iron to produce hemoglobin. So iron is essential for the production of red blood cells, and a deficiency can be caused by inadequate dietary intake, poor absorption of iron, blood loss from menstruation, or internal bleeding, and other factors. Another type of anemia is vitamin deficiency anemia, which can result from insufficient levels of vitamin B12 or folate in the body. So these vitamins are necessary for the production of red blood cells, and deficiency can lead to decreased red blood cell production and consequently anemia. So anemia can also be caused by chronic diseases such as kidney disease, cancer, or autoimmune disorders that interfere with the production or lifespan of the red blood cells. So in these cases, the body may not produce enough red blood cells to meet its results in anemia. So the symptoms of anemia can vary depending on the underlying cause and the severity of the condition. Common symptoms include fatigue, weaknesses, pale skin, shortness of breath, dizziness, cold hands and feet, and irregular heartbeat. Severe or prolonged anemia can lead to complications such as heart problems, cognitive issues, and impaired immune function. So, diagnosis of anemia typically involves a physical examination, blood test to measure red blood cells count, hemoglobin level, and other parameters, and sometimes additional tests to determine underlying cause of the condition. Treatment for anemia depends on the cause but may dietary changes, iron or vitamin supplements, medication, or in severe cases, blood transfusion. Prevention of anemia involves maintaining a healthy diet rich in iron, vitamins, and other nutrients essential for the red blood cells production. Regular health checkups and screening for conditions that can cause anemia are also essential for early detection and management of the disorder. In conclusion, anemia is a widespread blood disorder that can have significant effects on overall health and well-being. You were with me, Mpaso Lipava. Thank you. Okay, so this is the end of our discussion for today, and I thank you so much for giving me more information about anemia. So